On behalf of the League of Women Voters of Minnetonka, Eden Prairie, and Hopkins, I'd like to welcome all of you here tonight. We're going to start the opening statements with Bill Cullen, who is candidate for 42A.
Let me introduce myself for just a moment. I'm, as you said, Bill Cullen. I am a father, 2 wonderful daughters, attend Hopkins Public Schools. Married 17 years to my wife, Kathy. She's a nurse with the Veterans Administration. I've been a volunteer, very active in the school district as well as through other programs. I've served as a director in a nonprofit and included as the president of that. And I've been a business leader working in the corporate world as a director, as well as running my own small business today. I am running because I think that we can do things different. My opponent is where my biggest difference on my opponent is in the financial issues. I have watched her over the past 2 years. We've had a $3 billion growth in the budget over at in St. Paul. And yet my opponent still voted for another $1 billion in additional taxes. I think she is a wonderful person, great intentions, but I disagree in that growth in the government. Second, I think that we can do more leadership within the caucus in terms of authoring bills that help us here back in Minnetonka and Eden Prairie, as well as around the state. There are many differences. I know we'll get into it tonight: education, taxation, health care, transportation, and others, and we'll talk about it more then. But again, I'm looking forward to talking with you, and thank you.
Thank you very much. Now, Maria Ruud.
Thank you. It is a pleasure to be here this evening. I, too, would like to thank the League of Women Voters for hosting this event. My name is Maria Ruud, and I am the state representative for House District 42A, which encompasses southern Minnetonka and northern Eden Prairie. I live in Minnetonka, along with my husband, Mark, who is a small business owner, and our 2 children who attend the Hopkins Public Schools. When I'm not working to represent your voice at the Capitol, I work as a nurse practitioner at Park Nicollet Clinic. I ran on finding common ground, and in spite of a partisan environment at the Capitol, we were able to accomplish good things for the people of Minnetonka and Eden Prairie. We invested in our schools, we enacted tax cuts, and we passed laws to protect our environment. I deeply believe that the more people are engaged in the political process, the better the outcome. I have held an unprecedented number of town hall meetings and coffees. I have sent surveys throughout the district seeking your views. I value your input, and I strive to respond to each and every one of you. I have and always will run a clean campaign. I would not want to win any other way. I stand by my record, not the distorted record that some of you have been getting in the mail. I ask for your vote on November 7th so that we may continue our work together. Thank you.
Perhaps the most general question, first of all, is what do you think are the appropriate roles of the state and local governments in funding education? Maria Ruud.
Thank you. This is a #1 issue that we hear about at the door. It's a top priority of mine, and it will continue to be so. The state has a constitutional obligation to provide an education for all of Minnesota's children, and we want to make sure that the education that our children receive is not dependent upon the zip code that you live in. The state has fallen down in its commitment to funding the public schools. That being said, we have a district that very much supports the public schools, and I was proud to support legislation along with Representative Paulson. In fact, I was one of 3 Democrats who voted to help lift the caps for our district, because the people in our district feel very strongly about providing a quality education for all of our children, and that's what we'll need to continue to work on. Thank you.
Thank you. The next question will start with Eric Paulson. Oh, I beg your pardon. Of course you do.
Thank you. I'm not sure about this mic yet, but I think I've got it down. You know, education is a very personal issue, isn't it? I mean, I got 2 children, been very active in the education environment. In fact, just tonight before I came down here, I was doing homework with my daughter to get it ready for tomorrow. So it's very important to all of us. I hear it at the door, and I see it in my own family. And in fact, that's why I moved out to this district, is because of the excellent education system. So it's clearly a top priority. The funding program that we have today, federal, state, local, and user fees, it's a good system because it's balanced, okay? If you try and get too much of the funding on one element, for example, state funding, then you run the risk of the state having a bad year, and then you're unable to get the sufficient funding to the schools. The local funding serves good for the extras. The state and the federal must be the fair funding. I also think in time we need to move to a more performance-based system with more local control and fewer mandates. Thank you.
Thank you. There are several questions that have to do with health care. And since we were talking about education, I'm going to talk about health care for children. There's a question that's asked that states, recognizing that healthy children are the foundation for healthy students and healthy families, this last budget passed deep cuts to the family health care system in Minnesota. Many children with severe emotional disturbances are now not covered, and deductibles were raised, making families choose between health care and food. How will you address assisting the 68,000 children under 18 and 100,000 under 20 who are not covered by health care? Maria Ruud.
Thank you. Well, as a nurse practitioner, I have a lot of opinions on the healthcare situation. And next to education, this is the #1 issue that I hear about at the door. We do pretty well as a state, but the fact that we have 68,000 children without health insurance is immoral. It is really hard to take care of people in the right way when they don't have proper coverage. We have the programs in place right now that will actually cover many of these children, and what we need to do is we need to make sure that the people who deserve it, the people who need it, are accessing the system. Healthcare costs don't go away. It's pay now or pay later. The cost of healthcare simply gets shifted around. It is much better to make sure that we are providing preventive care and the services that get people into the clinics early so we can keep them healthy rather than pay to put them back together again. Thank you.
I believe that the issue with healthcare is more about cost than it is about access. I know that sounds backwards from the way that the question is, but if the cost is reasonable, then you don't have the access problem. People are able to get the healthcare that they need if the cost isn't out of control. Right now, the gross domestic product, 16% of the gross domestic product is consumed by healthcare, and it's growing at 3 times the rate of inflation. Until we control the cost, we'll never get control of the access, because the cost will continue to make it too expensive, and we'll start seeing rationing of care. Now, my opponent supports universal health care. I don't support universal health care. I think that a consumer-driven health care that opens up the market to all providers and all insurance companies is the way to go. Health savings accounts, expand it, make it available to all people that want to buy one, as well as get a high deductible insurance plan. And I think that will drive the costs down because the consumer will be more in control of what they're doing. Thanks.